Welcome to my YouTube channel, Homeopathic Super Sessions by Dr. Jarvis. Today I'll be doing a chapter from J.H. Allen, some of the ways in which suppression may take place. It's a continuation of the last video on suppression. Hahnemann in his Chronic Diseases, Volume 1, devoted 17 to 18 pages on the work of suppression. He lays stress upon the suppression from skin eruption. So as you all know, this is very important in homeopathy, suppression from skin eruptions. So if you read his book or rather his work on chronic disease, around 18 pages have been given on the same. Examples such as itch of the scabies, tinea, eczema, and other eruptive diseases. So other skin diseases like those mentioned out here, when suppressed, will give rise to suppression. Such diseases resulting from suppression may have the most fatal results, or a new disease process which is more dangerous than the first, which are difficult to eradicate. So the disease, when suppressed, naturally the disease travels from the periphery to the center and it becomes fatal, or an important organ may be affected, or a new disease process may erupt, which is much more dangerous than the first, and obviously it is difficult to eradicate. The most frequent methods used were the local applications such as itch ointments. So during Hahnemann's time, the itch ointments were made of sulfur, zinc, and lead. Medicated lotions, mineral baths, application of heat or cold, and persistent use of crude drugs internally. The removal of the local expressions resulted in the disease becoming more centralized in some organ of the body. So as I've told you, once you remove the local expression by such local application, then the disease travels from the periphery to center or becomes more centralized. The internal condition, however, remains unchanged and the progression of the disease increases. So what happens? The internal turmoil in the body, it remains unchanged. And naturally, the disease progress will increase. The local symptoms were actually secondary expressions of the internal disorder. So when there's an internal disorder, the body will try to preserve life and will throw out the expressions on some unimportant part of the body, for example, the skin. Therefore, the local symptoms are nothing but the secondary expressions of the internal disorder. Hahnemann noticed that the suffering of the organism was greatly relieved when the skin eruptions gave out. So Dr. Hahnemann noticed that when the skin eruptions came out, whatever suffering the patient was suffering from, that was greatly relieved. Or even the catarrhal discharges like diarrhea, dysuria, hemorrhoids, and abnormal growths. So you could have a discharge, or you could have some sort of an abnormal growths or hemorrhoids also, which will resurface, and that will bring relief to the original complaints of the patient. The result was the internal suffering ceased completely or was greatly relieved. So what happens when the secondary symptoms are thrown out? The internal suffering ceased completely or was greatly relieved. The local methods for treating skin eruptions, ulcers, and other local lesions which were in vogue at that time proved dangerous. So as you all know, during the old school of treatment, they were using these local applications rampantly because they were in vogue, they were in fashion to use such applications on the skin in order to destroy the external lesions. And naturally, that proved very dangerous. So what did they use? The use of cautery was abundantly used to destroy the chancroid ulceration. So during that time, there was chemical cautery of copper sulfate, which was used to destroy the chancroid ulcerations. Also, the modern use of X-ray is one of the most powerful suppressive agents used so far. So J.H. Allen says that also, even X-rays in the modern world is one of the most powerful suppressive agents. X-ray, if used according to homeopathic principles, will cure. But he also says that if you use X-ray according to the homeopathic principles, it will definitely prove beneficial and the disease may be cured. Naturally, if the symptoms match. The provings cured a number of cases from the 6 to the cm potency. So X-ray was proved on healthy provers and the symptomatology was gathered according to the law of similars. It was given and it had cured many cases right from the 6 to the cm potency. So Dr. J.H. Allen tells us that the modern use of X-ray is one of the most powerful suppressive agents. But when used homeopathically, it will cure the disease. Whenever there is a physiological process of elimination, nature steps in as a safety valve. So whenever there's a physiological process of elimination, like for example, diarrhea or excessive urination or dysuria or hemorrhoids or abnormal growths, whatever it may be, so nature steps in as a safety valve. So in order to preserve life, nature steps in and the secondary symptoms are thrown out. Thus in suppression, we have deflected and not destroyed nature's eliminative processes. So what are we doing in suppression? We have just deflected the energy in a different direction and we have not destroyed it. As you all know, energy cannot be destroyed. Its form can be changed. So this form of energy is deflected on a peripheral, less important part of the body, that is the skin. Thus, life and disease has to be restored in order to restore the disturbed harmony. So naturally, if you want to get into equilibrium, or if you want to bring the body back into a normal state of harmony or equilibrium, whatever disequilibrium is there, that has to be restored. Therefore, life and disease has to be restored in order to restore the disturbed harmony. Thus, we are dealing with motion, which is sensible and insensible, visible and invisible, voluntary and involuntary. So basically, we are dealing with energy. Energy is nothing but motion, and it could be sensible, insensible, visible, invisible, voluntary, and involuntary. This results in redistribution of the matter and the external manifestation of disease process, while not always visible, but can see the changes manifest themselves clearly. So what happens? This motion or this energy is redistributed, it is deflected, as I told you, it cannot be destroyed, it is just redistributed, and it is formed and it is projected by some external manifestations. Dr. J.H. Allen says it may not be always visible, but we can see the changes. Whatever changes are occurring, we can see it very clearly. It could be in the form of a discharge, it could be in the form of an eruption, and so on and so forth. Life continues to be a complex process. So J.H. Allen says that life is a continuous process, and also it is a complex process. He illustrates it by taking into account a child at puberty, where a complex process of hormonal growth is seen. So when the child reaches puberty, naturally there are multiple changes of the hormones going on internally in the body, and the changes seen. Thus, life becomes a very complex process. So because of these hormonal changes which are taking place in the interior of the body, life becomes a complex process and is subject to a number of changes and disease process. So whenever the hormones are changed, changes occur in the body, and as a result of it, even the disease processes may become rampant in the body. Therefore, he says life continues to be a complex process. Also, and furthermore, he says also miasms are multiplied, resulting in the complex process of suppression. So he gives another hint that in suppression, what happens? The miasms, they multiply or they go on increasing because of the complex process of suppression. So he says a miasm can be a single miasm, or a combination of two miasms, which become a complex miasm. The result being expression, which will differ according to the miasm present at the back. So whatever miasm is there internally in the body, its expression will be thrown out according to the miasmatic state present internally. For example, if the psychotic miasm is present internally, externally, you will get a thick, greenish, gleety discharge from any orifice of the body, or you may get warts or verruca on different parts of the body. Also, the latent miasm has to be taken into consideration. This is also very important. He adds that not only the miasm, but also the miasm which is latent has to be taken into consideration, which may be blocked due to the sins or lust or disobedience. So this could be blocked because of the bad habits of the individual, like sins, lust, or disobedience. Each having its expression on different tissues or organs. So naturally, each miasm has its own expression or its different expressions on different organs and different tissues, depending upon the miasmatic activity at the background. Thus, we have to deal it according to the principles of science of homeopathy. So if you want to successfully treat a case of suppression, you have to deal it with the principles and science of homeopathy. Thus, the miasms are the hereditary transmission or the perverted state coming out of such suppression. So the miasms, they are hereditary and they become perverted. Once they become perverted, then suppression will take place. Another point to be considered in the study of suppression of miasms is the resistance of the vital force. So another point he adds also that besides miasms, also we have taken into consideration the resistance of the life force. The resistance of the life force will vary from person to person. So J.H. Allen says that the resistance will vary from person to person. One person may have a strong life force, one person may have a weak life force, and so on and so forth. One may be gifted with more power than the other. In this way, the life force protects the organism against the unscientific and in the curative method of combating the disease. So in this way, what will happen? Because the life force varies from person to person, it has a different power from different persons. The life force, with its inherent power, can protect the person from the diseases as well as from unscientific and incurative methods of combating the disease. If the resistance power is below par, or when a mixed miasm like tuberculosis is there, then suppression becomes easy. So when the resistive power of the life force is low or is below par, or there's a complex miasm like the tubercular miasm, then suppression becomes easy. Thus, in suppression, we get change symptomatology, or it is present in imperfect light, and rest is covered from our side. So what happens in suppression? Naturally, we get the symptom will change, or the symptoms are presented in imperfect light. That means what? The symptoms are not very well defined, and the rest is covered from our side. So only a small fragment of the disease is visible, but the main chunk is not visible. That means what? You may get only one or two character symptoms, or you may not get any character symptoms, but you'll only get common symptoms. That is why the rest is covered from our side. For this, cases are illustrated. So I'll only take up the first case, then you can refer the book and see the other cases. So in case number 1, he says a young woman was infected with psychosis soon after birth of the child. There's a thick, dark, yellowish-green offensive discharge from a vagina. This was suppressed at an early stage by medicated douches. So medicated douches were applied, and as a result of which suppression took place, and there was a thick, dark, yellowish-greenish offensive discharge from a vagina. It was then followed by good health. So the patient thought the patient was totally cured. But 2 years later, uterine displacement and rectal adhesions developed. Cancer developed at a galloping speed, and that relieved her of her suffering. So, as you all can see, because of suppression, the disease traveled from the superficial level to the more deeper level, that is the uterine displacement and rectal adhesions, and cancer developed and death relieved her of her suffering. So 2 more cases are described. You can read them on the page number 117 to 119. As a rule, the symptoms of miasm cannot be suppressed or forced into a latent state. So, as a rule, Dr. J.H. Allen says that whatever symptoms of miasms are there, they cannot be forced or suppressed into a latent state. Why? The life force sooner or later gives out some expression which will depend upon the nature of suppression and the miasmatic action. So the life force, being reactive in nature, will give out some signs and symptoms which will tell us what is the nature of suppression and will tell us what is the miasmatic background of the case. In a case of miasm being suppressed, the symptom exhibited was spasms, convulsions, epilepsy, or spasmodic disease of some kind. So Dr. J.H. Allen says that when a miasm has been suppressed, especially with reference to this sentence, he says with reference to the psychotic miasm, when the psychotic miasm was suppressed, it was exhibited by spasms, convulsions, epilepsy, or other spasmodic disease of some kind. This was done when quinine was given in overdose for a prolonged time. So again, quinine, a drug given in large physiological doses over a prolonged period of time, could cause this. Another case of suppression discussed where suppression of rheumatism gave rise to asthma. So J.H. Allen has described another case in short that where when the rheumatism was suppressed, it gave rise to asthma. So correct treatment resulted in disappearance of asthma when the rheumatism returned. So if we give the right treatment, we give the right homeopathic drug, or we give the similimum drug, what will happen? The rheumatism will return and the asthma will disappear. So he has discussed many such cases in his book. He says there are three miasmatic conditions when suppressed gives disastrous results. So they are the acute itch or the sora, gonorrhea in the first or second stage, that is psychosis, and he introduces the malarial miasm, which is often called the intermittent fever. So a gonorrheal suppression will result in a leaky discharge from the mucous surface, the localized secondary inflammation of some organ like salpingitis, appendicitis, etc. Or it may have condition of the meninges, medulla, or some other part of the brain producing acute or subacute mania. So as you all can see, when the gonorrheal discharge is suppressed, it will go into the more important organs like the appendix, salpingitis, or the brain, and will cause acute or subacute mania. A malarial suppression, though not met so frequently, will result in soric or pseudosoric states. He says, of course, the malarial suppression, which is not seen very frequently, but however, if when done, will result in soric or pseudosoric states. That is what the tubercular element manifests itself and the organism becomes infected with the subtle poison. So what happens when the malarial suppression takes place? The tubercular miasm or tubercular element gets activated and it becomes a subtle poison in the body. If treated by quinine, arsenic, or other suppressive means, it results in death. So if treated by suppressive means like quinine, arsenic, or any other medication, it will result in death. Suppressed malaria will result in, he's given a different examples of asthma, chronic headaches, chronic liver and splenic disorders, tubercular developments, and bronchial cough. Hahnemann said that without a knowledge of threefold origin and homeopathic remedies, the successful treatment of chronic disease is absolutely impossible. So he says that if you want to treat a chronic disease successfully, you have to have the knowledge of the threefold origin and the homeopathic remedies. So by threefold, Hahnemann means the three chronic miasms, sora, syphilis, and psychosis. Again, he gives many cases. Please refer page 126 to 128. Burnett of England says that any form of suppression of ringworm will give rise to the tubercular diathesis. So Burnett has also said that if you suppress ringworm, it will give rise to the tubercular diathesis. Hahnemann, in the study of chronic miasm and the suppression, gave importance to, so whenever a chronic miasm is suppressed, number one, Dr. Hahnemann said that first point is that you have to see when was the period of infection which took place. Second, when the whole organism is tainted. And third, where external symptoms make their appearance. So you have to know the first phase as what was the infective period. After the infective period, how many days it took for the symptoms to come, or when the whole organism is tainted. And thirdly, when and at what time the external symptoms make their appearance. That is the secondary symptoms of the internal disorder. Again, many instances of suppression are given. The skin itch was suppressed in a 6-year-old boy with sulfur ointment. In a few days, it was followed by convulsions. Convulsions ceased only when sulfur was antidoted and the itch broke forth out again. So again, he's given an example of a 6-year-old boy with some skin eruptions. Sulfur ointment was applied, the eruption disappeared, and in a few days, the child began to have convulsions. And convulsions were stopped or they were ceased completely only when sulfur was antidoted and again the eruptions broke out. Another important form of suppression is that when symptoms make the appearance from time to time by the use of homeopathic remedies. He says that this is also another important factor, that suppression, another important form of suppression is that when symptoms make the appearance from time to time by the use of homeopathic remedy. That means in a case when you give the homeopathic remedy according to the symptom similarity, according to the law of similars, then the symptoms will come up. Once the symptoms come up, you have to know how to treat such suppressive symptoms. So in order to please the patient, we carry out the request to palliate or remove the annoying symptoms. So when you give the correct homeopathic remedy, the symptoms which were there previously or which were suppressed previously, they again resurface. So it is a common practice that in order to please the patient, we give some other remedy in order to remove the annoying symptoms. So Dr. J.H. Allen says, this is not in harmony with the law of cure or the teachings of Hindutva. So he said that if you do that, you are not following the law of cure or the teachings of our great master, Dr. Hannibal. After giving a deep-acting anti-miasmatic remedy, it should not be interfered with. So once you take the full case correctly and you give a deep-acting anti-miasmatic remedy, just give a placebo, just wait and watch. If the symptoms resurface, do not please the patient by giving some acute drug in order to eliminate those annoying symptoms. So it is the reactionary work of the life force under the influence of remedy which has been selected according to the law. So what happens when we give the remedy? The vital force reacts, and the remedy also has been selected according to the law of similar. Sometimes the reaction becomes violent and the acute expression of the miasms come. So what happens? Sometimes the reaction may be violent, and whatever miasmatic activity is there, the acute expressions will come out, such as pain, neuralgia, inflammatory processes, etc. In such situations, we have to interfere with the anti-miasmatic remedy, which is given as an intercurrent. So in such instances, you have to give an anti-miasmatic remedy as an intercurrent until the violent secondary expressions of the miasm subside. If it again resurfaces, then the same anti-miasmatic remedy is given. Thus, we have to watch carefully the retrograde process or the reaction of the vital force, which throws out the disease in its own peculiar way. So we have to see the reaction of the vital force and how it throws out the symptoms. If it throws out the acute symptoms of the miasm, then we have to definitely interfere with an anti-miasmatic remedy. Otherwise, not. So that's all for this small chapter. I hope you all liked it. Thank you very much.